Let me start by saying good afternoon and welcome to Sunnyside and Wortham High School for the opening of a new COVID-19 testing site. I want to start off by acknowledging a few people from the very beginning. Of course, we have Congressman Al Green from the 9th Congressional District who's with us. And then we have Kathy Blueford Daniel, who's on the HISD School Board, along with Camille Foster, the Chief of Staff for State Senator Boris Miles from District 13, who's here. I know Commissioner Rodney Ellis is on his way. I believe State Representative Sean Theory from District 146 is scheduled to be here as well, along with State Representative Allen of District 131. I also want to acknowledge Director Steve Williams with our Public Health Department and Dr. David Persse, who's our Medical Director. But in addition to that, I want to especially acknowledge Marlene McNeese and Deprecia Limbrick, who are the incident commanders with the Department of Public Health. Where are they? Y'all can come a little closer. I want to acknowledge both Marlene McNeese and Deprecia Limbrick because they are the incident commanders on the ground, helping to facilitate and make all of this happen. I know you see us all of the time, but I do want to acknowledge the hard work that the staff of the Health City of Houston Health Department have done in setting up all of these sites and doing it very, very quickly. So very much appreciate what you all do, and please extend my thanks to the others in the health department because they've been working night and day. And then this is a site that's also been stood up in collaboration with the Texas Department of Emergency Management, and NEMKID is over that, over TDM, and so I want to acknowledge them in the state as well. We're in district, this is district,
D.
Oh, I'm sorry. This is this is it. We're in District D. I knew that, but I wanted the council member to echo it out. And I certainly want to recognize the council member, Dr. Carolyn Evans Shabazz, for her presence and the work that she's doing in her district, but quite frankly, it's having an impact across the city as a whole. So thank you, council member. We have other COVID-19 testing sites across the city, and this one will bring vital COVID-19 testing resources closer to vulnerable communities. In fact, this is one of those communities that was highlighted in the Houston Chronicle's article a few days ago as being, I guess you can say, one of the hotspot areas of the Sunnyside area. And I know this is one of those areas, in addition to the council member wanting the testing site here at Worthing, State Senator Boris Miles has been an advocate champion of putting a testing site here as well. It opens today and will operate through May the 3rd, daily from 9 a.m. to 5 p.m. or until the site reaches its daily capacity of testing 150 people. So that's the capacity for this site. It's a mobile testing site. 150 is the capacity. This site requires an appointment because it's limited in terms of capacity. It requires an appointment, and you can make one by visiting txcovidtest.org, txcovidtest.org, or by calling 512-883-2400. That's 512-883-2400. We know that African Americans and Hispanics, along with the elderly and people with underlying chronic health conditions, are disproportionately getting sick and dying from COVID-19. If you do not fit that description, it might be easy to look the other way, but we all have a responsibility to protect the vulnerable in our community and in our families. As of today, the numbers for today, we are reporting 96 new cases of people who have tested positive for COVID-19. That will bring the city of Houston's count to 3,515. So we're adding 96 new cases today. And as of today, we're adding 2 more to the count of people who have passed away as a direct result of COVID-19, and that will bring our total count to 52. The 2 persons who we are adding to that list today is a Hispanic female in her 90s that died on April the 15th of underlying medical conditions. And also an Hispanic male in his 70s who died on April the 24th, also with underlying medical conditions. So as you see, when you combine African Americans and Hispanics in terms of the number of people who have died within the geographical limits of the city of Houston, Hispanics and African Americans are making up pretty much about 75% of that 52 that have passed away. And we also know COVID-19 is more widespread in our community, hence this testing site here. There are more people who likely have the virus and are not showing symptoms and have not been tested but could infect others. And that is why testing, and more testing is important, especially as the focus shifts to returning to work and reopening businesses. And we all want to make sure that people are maintaining social distancing, wearing face coverings, and that we are doing as much testing as possible, because the test becomes our eyes in terms of where this virus is and will give us a better indication of how prevalent it is within our community. Is the curve flattening? Yes, the curve is flattening. That's I think the data and all of that indicates that the curve is flattening, but we haven't yet reached the peak, and so we must remain vigilant and keep working to stop community spread of the virus. Today's opening of a COVID-19 testing site in Sunnyside underscores that the fight to end the pandemic is not over and our work is not yet done. And we will keep testing and taking other measures to save people's lives. Now, at this point, let me yield and let me first bring up the Councilmember Evans Shabazz, for her remarks.
Thank you, Mayor, and certainly thank you on behalf of the constituents of District D, the District of Destination. And so certainly I am very appreciative to the Mayor for his leadership and for providing masks to the constituents and to the city. I want to certainly thank our Congressman, Al Green, and just let you all know that we are so appreciative, and certainly to the Senator, Boris Miles. Just so appreciative. I used to actually work at Worthing High School. Certainly I want to say that I know that we're talking about opening the city, but these masks are very important. I said that I would rather cover my face with a mask than be covered with a sheet. And so certainly I know the importance, and I want to highlight two events. One is at the Southeast Community Church tomorrow at 11 a.m., where we have Pastor Thurman West and Pastor Terrence Hall. At 11 a.m., they will be giving out masks and gloves. And today we will have communion and mask at the Metropolitan CME Church, Pastor Alan Page. Come out, get communion, get gloves and masks, and that will be from 10 to noon today, Friday, and Saturday. And so certainly thank you to all of you, especially to the media, for getting this word out. And we're going to flatten the curve together. And thank you so very much.
Thank you. Congressman Al Green.
Thank you very much, Mayor. I greatly appreciate this opportunity and want to especially thank you because we had a conversation about having a site in Sunnyside, and you have responded expeditiously and positively. And for this, I am grateful. Also like to thank Dr. Evan Shabazz. She and I work closely together on many projects. This is but another project that we are working on. Senator Miles, who is not here, has indicated to me that he would have you know that he is here in spirit. And I'm honored to stand for him at this time and with him. I am the representative for this area. This is the 9th Congressional District. And I'm honored that we would have this opportunity to have members of this community accorded the opportunity to be tested. This coronavirus pandemic has highlighted the interconnectivity within humanity. 100 days in, and we've had nearly 1 million persons confirmed with cases of the virus. More than 55,000 deaths in the United States alone. Although today we are here in Sunnyside, this is really bigger than Sunnyside. Because what happens in Sunnyside can impact the east, west, north, south sides. It can impact all sides. And the lesson that we must learn from this inescapable truth is that we must concern ourselves with what happens to others because it can happen to us. It would be a mistake to conclude that we should not dispatch with all deliberate speed the necessary resources to vulnerable communities such as Sunnyside simply because it's not where we reside. Where we reside is always important. But this pandemic has demonstrated to us that that which was birthed across the oceans can traverse the oceans, span the mountains, and find its way to Sunnyside, Texas. We cannot conclude that we should only concern ourselves with where we reside. We're all in this together, and we will all come out of this together. United, we can. Not just we stand, but united we can. United, we can have the testing. United, we can have the tracing. United, we can have the masking. United, we can bring this virus under control. But it does require unity, and I'm proud that this mayor has extended the hand of friendship across all of the lines that sometimes divide us and has brought us together so that we can impact this problem, this coronavirus. Finally, Mayor, I want you to know that your health department has worked closely with us. They've done an outstanding job, and I'm proud to thank them here today for this. Remember, dear friends, this is not about just Sunnyside. It's about every person on the planet Earth. I thank you, Mayor.
Thank you, Congressman. And while we are talking, been told that testing has already started here at Sunnyside. I do also want to acknowledge Senator Boris Miles. He started early on calling and texting, wanting a site in Sunnyside and wanting a site right here at Worthing. So I want to acknowledge him, and representing him is his Chief of Staff, Camille Foster, and Kathy Blifford is also here. Are you both? Camille.
Good afternoon. Senator Miles couldn't be here today. He had to be in the house. As you know, he had a kidney transplant, so he's a part of that group that would be affected adversely. But he was so excited last night when he got the call that this testing facility would be here. He has been advocating and fighting for this from the beginning, fighting for testing facilities to be in the African American community because we are the community that is being hit most by this disease. It's important now more than ever, since the economy is starting to phase back and reopen, that they get tested, that they know what they have, and if they do, they can be treated for it, and if they don't, that they can go ahead and go back to work and start a normal life. We can't stop. This is the first in the beginning, but he'll continue to fight for this and advocate for this. And again, he thanks Mayor Turner for listening to him. I know he's beat on his door and his phone often, Congressman Green, from the state to the local level. So this is important to him. He's very happy about this, but there's more that still needs to happen, and we'll continue to work. So just keep the faith and keep the fight. Thank you.
Thank you, Camille. You were very generous in your comments about beating on the door. He did more than that. I will tell you, I love you, my brother. I know you're watching, so chill. At this point, let me, before I call up Commissioner Ellis, let me call us Director Stephen Williams. He's just been very vital and instrumental in this whole process and helping to facilitate these testing sites. And again, he's gotten a lot of those calls in Texas as well. So Director Williams, you can let us know what's happening out here today.
Thank you, Mayor. Good things typically don't happen without good leadership, good elected leaderships. And so I want to express my gratitude to my boss, Mayor Turner, Councilmember Shabazz, Senator Miles. You're right, he texted and called us a lot. Congressman Al Green, I want to acknowledge him because he actually, on one of our first weekends, we were running out of supplies at Butler. He was able to help us access some masks. So I'm grateful for that help. HISD board member Kathy Buford, thank you for your participation in this. And County Commissioner Rodney Ellis, I get phone calls from him too, Mass, although I work for you. On Monday, I joined Mayor Turner and other elected officials in opening up a very similar site in the Southeast. That site, as well as this site, have one goal, and that goal is really to provide resources, testing to vulnerable communities. We know that COVID-19 is an equal opportunity virus. We know that there are certain people that will experience more serious outcomes if they are affected with the virus. That includes people that are 65 and older with underlying health conditions like diabetes, obesity, sickle cell, lupus, cancer, and other conditions. And so it is very important for us to really provide testing, in this case, and access to these vulnerable communities. People can visit HoustonEmergency.com for a list of places to get tested, and HoustonEmergency.com. As a health department, I'm grateful to my staff for being willing to answer the challenge related to COVID-19, and we commit every day to the challenges related to COVID-19. We will continue to do outreach in vulnerable communities and provide access via mobile sites or fixed sites. Thank you.
And of course, Dr. Persse, who's working right alongside Director Williams in all of this. Dr. Persse. There he is.
Thank you, Mayor. And I'd like to thank all the elected officials here because they've all contributed through this entire event. Elected officials have come together and been there when we needed them. As has been pointed out by the mayor and Director Williams, we're getting phone calls from elected officials, but don't think that we haven't called them and asked for help, and they've been there for us. So to all the elected officials, thank you so much for your help. And Mayor, I'd also like to thank you for pointing out the hard work of the members of the health department. So I wear two hats in the city of Houston. I'm the EMS medical director and I'm also the public health authority. So in my role within the fire department, I have for many, many years, seen that first responders are recognized for how they go into put their lives in line and put themselves in the line of fire sometimes with what they do. In my last 16 years of the health department, I've come to recognize that those folks who go out and deal with people who have infectious diseases in particular are also putting themselves in the line. But the health department workers, those people that go out in the street day after day, sometimes don't always get the same attention. So I want to thank you for pointing that out because Marlene and Decretia here represent a growing army of folks that we need to battle this really difficult problem with the coronavirus. On Monday, I gave an example of how a virus started a domino effect of cases from the Egyptian river cruise. And in that, I talked about a traveler from Taiwan who, at that point, we thought was the index case. And I want to thank, let me make sure I get the name right here. I want to thank the Deputy Director Chang from the Taipei Economic Cultural Office of Houston, who emailed me last night with some interesting information which we didn't have before, at least I didn't have before. And that was that some genetic sequencing research was done on that case. And it was determined that there is a high probability that that case was not infected in Taiwan, but rather was actually infected in Egypt. And so that was new information, but it underscores the point that I was trying to get across, was that with this virus being able to infect people without causing them to have symptoms, but allowing them to then spread the virus, we all need to have our guard up. We cannot drop our guard. And in that example, I pointed out how the people who are on that river cruise, and we've seen this with other cruise ships, the cruise environment is one which is really conducive to viruses, and we've seen this for many, many years, set off a domino effect where a large number of folks got infected. So it doesn't really matter who was the index case. The point is that any one individual, if infected and not knowing it. So this is why testing centers like this are so very, very important. So if people think that they have symptoms and think that they may be infected, they absolutely should take advantage of one of the many, many sites that we have available today. And now we're actually getting the testing sites out into those neighborhoods which traditionally don't have access to healthcare. And I can't underscore how important that is. So again, thank you to everyone who has facilitated that. And for those of you who come and get tested, an important reason for you to get tested is that if you should be positive, and I've said this the last couple of days, that then empowers you to protect your families. And just ironically, just yesterday, the New England Journal published an article, and it's a little bit small, but it talked about the amount of spread within a household if an individual is infected, and how that spreads within the people in their own home. So the people that we all care about most are our family members. So it turns out that on average, 16% of the people in a household would become infected by one person who was infected and didn't quarantine. But if they quarantined themselves, it dropped to 0. And not ironically, but they looked at which member of the household, and of course adults spread it to adults more than they spread it to their children, and spouses spread to spouses nearly 30% of the time. So I want to make sure that people understand the value of how you become empowered to protect the people most important to you when you get tested. And then the other thing I want to point out is that we are seeing something. I'm going back to my emergency medicine EMS hat. We are noticing within the Houston Fire Department, we're noticing a decrease in our total call volume. It's down about 20% since the beginning of this whole thing. But more concerning to me, as we look at the data, most of those seem to be the non-emergent calls have dropped off. But more concerning to me is that we are seeing a slight decrease in the number of heart attacks that people are calling 911 as well as strokes. And so one thing about that is coming out and has been in the media about this virus is it does seem to affect the blood and cause clotting, and clots can cause heart attacks and cause strokes. So ladies and gentlemen, if you think you're having the signs and symptoms of a heart attack, or you think you're having the signs and symptoms of a stroke, you need to call. There was another article that was published actually just yesterday. It was a series of only 5 patients who had had strokes. They were all infected with the COVID virus. They were all less than 50 years old. And the lead article was of a young woman who had a stroke. She had developed difficulty speaking. She developed weakness in her arm and leg. And she didn't go to the hospital because she was afraid that she would catch the virus if she went to the hospital, because she didn't know that she was already infected. And so again, this virus is insidious. Please come to these sites to get tested. Take advantage of the testing that all the people back here work so hard to put together for you so that you can protect yourself and your family. And if you do that, you know, Houston has done really, really well when we compare ourselves to New York and New Orleans in particular. It's because people are doing the right things. Let's keep it up. The folks behind me are doing what they can to get the testing sites up. Y'all need to take advantage of it so you can take care of yourselves and your families.
Thank you, Dr. Persse. And the city of Houston works very closely with the county. The county has been an incredible partner with the city of Houston. Judge Lena Hidalgo, as well as the county commissioners, and representing this area is County Commissioner Rodney Ellis.
Thank you, Mayor. All protocol observed. That's what I would see Mayor Turner do when he's traveling abroad. With these face masks on, I'm not sure who's standing with me anyway. But in case I want something out of it, let me thank Mayor Turner, the congressman, Senator Boris Miles, my cousin-in-law, the council member Shabazz, and school board members who are here. It is important. Look, I'm glad to be here, even if I'm late, because this is my high school. You're in the heart of Sunnyside. And I know that other people have spoken, so I just want to make a couple of quick points. Maybe somebody said it. It's an African-American neighborhood, obviously. Black people in America are 3 times more likely to contract COVID-19 and 6 times more likely to die from it. Now, why? It's certainly not because it's a black thing or it's a minority thing. It's because long before this virus showed up, the virus of inequality, the virus of lack of health care, the virus of food deserts, and all of those issues, dirty air in certain neighborhoods, our immigrant neighborhoods, our minority neighborhoods, has been around for so long. And those underlying factors exacerbate this problem. Second point, testing matters. Hasn't the world changed? Now the most important thing you can have is some isolation, a face mask, and a test. Testing does matter. In the state of Texas, I read, at least this was the case, Mayor and Congressman, a week ago, Texas ranks 49th out of 50 states in testing per capita. Just 332 tests per 100,000 people to date. Only Kansas is lower. And that's why, Mayor, I applaud you, the congressman, the council people, my colleagues in county government. It ought to be a bipartisan effort to get testing done and in neighborhoods that have more difficulty getting tests than others. So thank you, Mayor.
And again, I do want to acknowledge State Representative Sean Theory, who represents this area, District 146. I believe her chief of staff or staffer is also here, so I do want to acknowledge her. the district director for State Representative Sean Theory. And I know this is an issue that's very near and dear to her, and she's been very active and very engaged in this process. And I do want to acknowledge HISD, because they are allowing us to set up at this facility. Kathy Bluford Daniel is here as a trustee of HISD. So trustee, thank you. And I do want to thank the superintendent. When I called and asked for permission to set up here, she readily agreed. So really want to acknowledge HISD. They have been a tremendous partner on multiple levels. The food distributions with the Houston Food Bank with HISD have just been awesome. And I do want to thank our collaboration here with the state, because this is the state Texas Department of Emergency Management that's providing the mobile unit, and we are partnering, collaborating with them. So I do want to acknowledge and thank NIMCAD for his collaboration. Quite frankly, all of this is on multiple levels. With the federal government, Congressman Al Green and all of them that are making available the dollars that we are needing for testing, additional testing. I want to thank them. Then the state, then of course our county, and then the school district, all working in collaboration with the city.